White House hopeful Andrew Yang on Saturday unveiled a plan to address health care for children and adults with disabilities. Yang, an entrepreneur whose son is autistic, said his plan would expand care for those who have disabilities and ensure that plans cover preventative care for those who need it. As a father of a son with autism, I understand the hardships millions of other American families face every day, Yang said in a statement. Children and adults with disabilities need a wide range of medical and long-term services and support that our current healthcare system does not prioritize, and we need to do better by them. Early detection and intervention and ongoing support is critical for parents of children with disabilities to understand and meet their child's needs, he continued. Our healthcare system should ensure all families have access to necessary experts and resources that equally uplift our children. Yang's plan would ensure that all hospitals are compliant with the Americans with Disabilities Act of 1990 from the George H.W. Bush era, and guarantee that all families have access to experts and resources for early detection, intervention, and care for children with disabilities. He would also make healthcare more accessible by having plans cover public transportation to hospitals and ensure that providers cover preventative care services for people with disabilities, including assistive mobility devices, hearing aids, adequate catheters, and physical therapy visits to prevent further secondary conditions. Healthcare has become a chief point of debate among the 2020 Democrats, the contenders weighing whether to expand the Affordable Care Act and include a public option or transition more toward a single-payer system. So I like, and this is something I haven't seen anyone else's plan mention, the need for transportation to be funded, because I think a lot of people, when they talk about healthcare, assume that we just all live around hospitals and that, it doesn't cost, let's say if you want to take an Uber to a hospital, 30, 40 bucks to get down there, depending on where it is, of course. But I like that this is seemingly one of the few plans I've seen that has discussed transportation and doing something in reference to that. Now, I would say out of all the different plans, I don't think anyone's really talked about disabilities, just specifics of something to do pertaining to them. Now, obviously, we've had single payer and we've had the other parts of the system described, but you don't really hear anyone talking about mental illnesses as it relates to healthcare. So, good on Yang. I hope that we see some more proposals. I just wish, and I've tried to make this point to some of his supporters before, I want to see between now and Iowa more discussions, or at least more remarks on his part in reference to his other policy ideas. Like, we still don't hear that much about foreign policy. We still don't hear that much about, we know he supports, some kind of expansion of the ACA, or rather a public option, but we don't hear him talk that much about a lot of these other proposals. So I wish that we get more of that. And this is promising for, actually knowing more about his positions on other issues. And I'm so glad that one of these Democrats brought up the Americans with Disabilities Act, because a lot of times when politicians are trying to cater to whatever party they're a member of, they try to pretend everything the Republicans ever did was so horrible. So I'm glad that that's getting referenced here.